Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.
Joel Jacobson of Burlington is a Democratic candidate in the 63rd Assembly District. Joel, welcome to WisconsinEye.
Thank you very much. Greatly appreciate the opportunity.
Your campaign website lays out a huge goal: restore the middle class. How could you, as one member of the Assembly, take a step towards that?
Well, of course, as a sole member of 99 Assembly persons, I couldn't do that on my own. But certainly, one of my goals is to help move the needle. And if you are part of government, whether it's at Aldermanic County or state, you can help make things better for Wisconsin citizens, Racine citizens.
Well, we're a few miles from the proposed Foxconn campus. We better go to that subject pretty quick. Do you support the state tax benefits, tax breaks for Foxconn that were approved?
I think the decision on Foxconn was in error. That we are going to be living with Foxconn. But I think that the overall amount of dollars that the state is investing in this project is incomparably huge. I think it's the largest in the United States of its sort of investment. And we aren't even a large state. We're not a New York, a California, or an Illinois, and yet we are putting over $4 billion in state tax dollars. I know there's incentives, and it gets a little more complicated than that, but at a project at a company that will probably not even begin to get close to the 13,000 jobs that they tout, and is moving towards automation, robotics, and so I think the investment was poorly decided.
You don't think then that Foxconn will hit its targets of $10 billion investment, 13,000 jobs?
No, I do not.
Okay. You would have voted against the incentive package?
Yes.
Okay. That led to Kimberly Clark asking for some of the same benefits. When should state government help out a private company?
That's a great question, because I think we're in a catch-22 in the United States relative to companies saying, oh, I will stay here or I will invest here if you throw tax dollars at me. And I think that that's a downward spiral towards investment in the United States. So for example, we'll use Kimberly Clark as an example, or any corporation. They say, well, if I don't receive enough dollars, I'm going to run off to Texas or South Carolina or China, Brazil, etc. And that is not really good for the taxpayers. What you're doing is you are socializing the risk and privatizing the profit. And that, in the end, that does not appear to be working, and we've seen this over the past 40 years for Wisconsin citizens or U.S. citizens.
As a former local elected official, how do you feel about levy limits? Should we keep them to control property taxes, dial them back, or get rid of them?
I think dial them back, I think, would be the best. The feedback that I have heard is that we need to have more local control and let the local municipalities decide what is most appropriate for their governments rather than being dictated by Madison, which is in contradiction to the typical Republican philosophy, because they usually say less government is better, but apparently not in this particular case. Let me use an example of the minimum wage. So minimum wage, in thinking about this relative for control by local government. So if you're here in this area or Madison, to start approaching that $15, not all at once, is a good thing. But when you start getting up by Minocqua, smaller counties that are very rural, you would put too much pressure on the smaller businesses to try to push to that $15. So I think it'd be much better to let the local governments decide how you would orient the minimum wage.
How would you like to see the gridlock in the Capitol on how we pay for our highways, bridges, construction, and maintenance broken? If you're in the Assembly, how would you work towards breaking it?
That's a great question. We need to obviously put more money at it to that cause, because where we're sitting, of course, we're getting a lot of investment due to Foxconn. and of course there's road construction everywhere, as you may have experienced on your drive here. But when you get farther out into the rural counties, it's a problem, and of course I drive those roads too, where we all experience what we feel like we're injuring the suspension of our cars when we're trying to drive over these roads. And as I've seen quoted before, we are either second to last, I think 49th as far as road conditions. So obviously we need to do something, and in seeing some of these discussions relative to tolls, I know has come up, gas tax, which is a regressive tax, which I basically oppose. So I think all things are on the table. We need to do more studies relative to, what do we do? We need to improve the roads. We need to invest in the roads, but exactly how that be. And I'm one of those exceptions that we may consider in certain areas using a toll system. Again, not saying I'm outright in favor of it, but I think we do need to take a look at this, but we do need to do something. So
Tolling as opposed to raising the gas tax or the $75 you and I pay to register our vehicle.
Right. That would be another, and that's a typical southern state approach, which is when they tout that they don't tax, have the income tax, et cetera. What are they doing? They're utilizing items such as you mentioned. They'll tax based on the value of your vehicle, or there's other ways that they do it as well. So, but I think that any solution should be non-regressive. So you could maybe use tolls or use use the gas tax, but then for those who are least income, then some way to get that back in their pocket, because you are hurting them. So the person who makes $30,000 is paying the same gas tax as someone who's making $500,000.
The current state budget included more than $600 million in new money for K-12 public schools. Do we need a similar big increase in the next state budget? How are Wisconsin public schools underfunded?
Absolutely, they're underfunded. We need to expand our funding for public education. As has been referenced before, we are basically at 2009 levels. What I think in the Republican view right now, they realize that so many Wisconsin citizens are very, very concerned about the education system going backwards. And now in election year, they are touting that how much they want to invest, and now we need to move forward on education funding. But what have they been doing the last 8 years? And what will they really do if they remain in power? So, no, I think that we need a change in leadership, a change in the legislature, so that we can go back to the strong education state that we have always been.
The choice program, the voucher program, started in Milwaukee, expanded to Racine. Now it's statewide. What's your position on the voucher program?
I think that it should be greatly cut back. I think there's considerations for the largest school districts, Milwaukee and Racine certainly being, I think Racine's number 4 and Milwaukee's obviously number 1. But for the rest of the state, I don't think the private schools need our tax dollars supporting them. Interesting story that I want to tell. My wife just ended her term with a Catholic high school, and so we have interesting internal discussions in our house relative to the use of vouchers in the system. And my children are a product of Catholic education and a terrific education, but that doesn't mean that tax dollars should be utilized for supporting private schools.
A big issue in the next budget will be the Department of Corrections and whether we need a new state prison. 2 of our prisons were built in the 1800s. Some Democratic candidates for governor said over a few years you could cut our prison population in half. Do we need a new state prison?
I don't know the answer to specifically having a brand new prison. I think it depends on how bad the facilities are that we currently have versus what needs to be built for the future. You could have these buildings that are just so economically unviable that you really might need one. I'd have to take a look at the numbers on that one. But I will say this, we are double per 100,000, or close to double Minnesota on our incarceration rate. The United States is one of the highest incarceration rates in the world. We're not learning the lessons from other states or globally as far as how to reduce our incarceration rate. And not only that, the impact upon society of somebody ending up in prison for nonviolent offense, and now they're trying to get a job, they're trying to support their family. It really injures society all the way across the board, and we really need to take a look at other solutions for our incarceration rate. Other states do it, other countries do it. Why can't Wisconsin?
Let's talk about healthcare. How would you protect and maybe expand healthcare in the rural areas of Wisconsin? Thoughts on that?
First of all, on the accepting the Medicaid dollars, federal Medicaid dollars, absolutely. That needs to be done as quickly as we possibly can. For rural, I think that this is, and I've seen this question come up before, where some are saying, oh, rural versus urban versus suburban. Rural counties, I think, have a unique situation where they have doctors are not as inclined to be there, or healthcare workers. And so I think the state really can assist and take a look at the poorer rural counties of Wisconsin and help them out.
As you campaign, are you hearing from hospitals and medical professionals that Wisconsin's Medicaid reimbursement rates are too low and we could be at a tipping point in terms of whether we can continue to provide quality health care through our Medicaid program? Has that issue come up?
Yes, I've seen some feedback on that, and I believe it's Wisconsin Hospital Association has also sent emails on that. I think that overall, whether those reimbursement rates need to go up or not is not necessarily the question. I think the question is, why does the United States pay $10,300 approximately per capita and for health care, while Australia and Canada pay about $4,500? What are we doing wrong? What can we do to fix this? Because we have a lot of dollars, maybe up to 25%, just going into administrative costs. And in the meantime, I think it's the biggest concern of Wisconsin residents, most of them, that their healthcare costs are just going to go up. Obviously, we have the controversy over when you have a pre-existing condition. Thank you.
Yep.
And people are very fearful of what's going to be happening here. And so I think that, again, in the short term, that would be something to look at to see if we can expand those dollars for if they're being properly compensated. But at the same time, we need to really look at the overall system. What are we doing wrong? Why do we cost so much more than every developed country, basically, in the world?
State government and Delta Dental have a pilot program that provides dental care to low-income residents at some regional clinics. Have you heard of this program, or is it new to you?
Yes, I have heard of it.
Should it be a priority in the next Medicaid program?
Yes, I think so. I think that when you look at dental, you look at include vision in that as well. We need to have overall health considerations, and that includes the overall person, not just selective aspects of it. And as I've seen mentioned in other interviews that you've done by those who are trained in medicine, that dental health is as critical as all the other aspects that we typically associate not with going to the dentist or going to the eye doctor, including higher heart disease rates, I think was mentioned as well.
As you campaign, have you heard about an issue from caregivers? AARP estimates that 578,000 Wisconsin residents are caregivers for family members or neighbors, people they love. So my question is, would you support laws or rules that require hospitals to recognize and work with family caregivers when someone they love is hospitalized? Has this issue come up?
Yes, I have seen reference to that issue, and curiously enough, I was able to help my 90-plus-year-old father-in-law and engaged in that. Luckily, he has 9 children, so I was not just me, but I participated in that. The point being is that I think you get into situations where people do not have close family members, or their family members have no way of helping them out. And in those particular situations, we need to seriously look at what can we do. Now, I think that the medical community is aware of this, and I think they're moving forward and trying to assist as much as possible, trying to keep people home, trying to keep that care in the house, because people do much better if they are home. They're going to heal faster, or they're going to have a better quality of life, if at all possible. To look at it, but exactly a state solution, I'm not sure of that. I think that we need to continue to get feedback from all parties involved in this to see what level the state should be involved in affecting this.
The proposals in the Capitol to legalize recreational marijuana and medical marijuana, your positions?
Medical marijuana, absolutely. We need to move forward on that as quickly as possible, not only for the opioid crisis. Obviously, there's a lot of research coming out relative to long-term chronic pain. It's helping those people, mothers and fathers who have children with epilepsy. That there's been some evidence on that. Again, that we need more research into that as far as those particulars, but I think that the evidence is in as far as moving forward on pretty strong medical access for the state of Wisconsin should be completed as quickly as possible. As far as recreational, I think we need to have a statewide referendum, and so that the citizens of Wisconsin, if they say yes, this is appropriate for us, then the citizen center that we participate in democracy, that we could move this forward. Now, that being said, should it be implemented, there are lots of revenue. I don't know what the revenues of Colorado are. They're very large, and there's, of course, one of the states we would study on what their challenges are, et cetera. But the revenue increases would be excellent and could really help out. First thing you would probably take a look at is education on marijuana, on cannabis, as far as to make sure, because it is a drug, there's no doubt, just like alcohol is a drug, nicotine's a drug, and by all evidence they're far more damaging and addictive than cannabis. So that being said, I think the people of Wisconsin need to decide on recreational marijuana, and we need to get a statewide referendum for it.
Do you want to highlight differences between you and the Assembly Republican leader you're challenging?
Well, Mr. Voss is a career politician, and I certainly am not. I think that oriented from straight out of college, that was his goal, was to be a politician. He has the conservative ideology. In some cases, I think it's extreme ideology relative to what can help the middle class. We've been going backwards for the past 40 years, and the orientation is that smaller government is better. Well, every time I see smaller government is better, it seems like the middle class shrinks a little more. Right now, 1% owns at least 40%, in excess of 40% of the entire net worth of the United States. With current tax policies, especially at the federal level, but also active within Wisconsin level, you're going to have the 1% owning 50% of the entire net worth of the state of Wisconsin. I don't think that works at all. I think we need to move back towards what a middle class is, what we did 1950 to 1980, which is when we grew the middle class. We were an example for the entire world, and I think Western Europe, Australia, Canada, et cetera, they saw that, and they have implemented policies and stayed on that track. What have we done? We've gone backwards. Our middle class is shrinking, and at the top of that is the healthcare costs, because there's basically no control, and it appears with the lawsuit on pre-existing conditions that the Walker administration wants to implement, it's going to get worse. And so we can have this growth. Obviously, our unemployment is good, even though a lot of people say our wages aren't going anywhere or our benefits are going backwards. So I think we need to make some changes in philosophy and government and start growing our state for middle class, not for a few people, some of them who don't even know how many houses they own. So,
Joel Jacobson of Burlington is a Democratic candidate in the 63rd Assembly District. The election is November 6th. Mr. Jacobson, thank you for talking to WisconsinEye.
Thank you very much. Appreciate the opportunity.
Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.